We will call the meeting to order. Sawyer County Health and Human Services, Tuesday, April 12th. Meeting. Roll call.
Dale Schleger,
Here.
Pete Schumann.
Here.
Dale Olson.
Here.
Chuck Bennett. Don Pettit.
Here.
Wayne Gouget. Here. Jen Vabornik. Carol Pearson. Here. Sabrina Dunlap.
She was just outside, so I think.
Okay. Certification of compliance with open meeting laws.
This meeting has been noticed to the public and news media as required by section 1924 of the Wisconsin statutes.
Okay. Meeting agenda. Any changes? So we'll move on. Public comments. Anybody in the public wish to make any comments? Anybody online?
No.
Okay. Approval of last month's board meeting minutes.
There were two because one was not attached last time.
That's right, there's two of them. We can do them together. Then we can do them together, can't we?
I believe you can,
Could I-
unless there's changes to one.
Have a motion to approve.
Motion.
Motion by Deanna Pearson. Second. Please, I need a
Yeah,
second.
yes, sir. Sorry.
Second by Tweed
Second.
Schumann. Okay, Lorraine, LCO liaison.
Okay, I'm gonna give an updated report. First off, the report that was handed to me by a public health official. The LCO Health Center has had 2 positive cases of COVID-19 in the past 3 weeks. We currently have only 1 active COVID-19 case. We have done all contact tracing and quarantine with recommended by quarantine guidelines in order to control the stages. We have changed our policy of masking from all health center employees, mandated masking to healthcare providers, direct patient care are required to wear masks at all times, or any employee who with others for 15 minutes or more. COVID-19 infection rates remain low. Should infection rates surge, we will have mask requirements for all employees. Our medical director, Dr. Steve Miskowitz, God, I have a hard time pronouncing it, has sent out notices on all media sites to inform patients that it is safe to return to regular medical appointments for care that was put off during the surge of the pandemic. Patients are being scheduled for regular checkups at this time to address health concerns such as high blood pressure, heart disease, diabetes, etc. The LCO Health Center recently received a certificate of commendation from Governor Tony Evers, whereas the sovereign nation, the Woodcutter Band of Lake Superior Chippewa Indians of Wisconsin, and its tribal leaders, frontline staff, and members have worked to protect cultural knowledge keepers, first language speakers, elders, children, and other vulnerable members of their community. And whereas the Woodcutter Health Center has made valuable contributions to the Woodcutter Band of Lake Superior Chippewa Indians of Wisconsin, and has also extended outstanding and exceptional public service to non-tribal community members and staff in its duty to safeguard the health and safety of Wisconsinites over the course of the coronavirus pandemic. I also wanted to note, going back to the pandemic, in the governor's report the other day, we lost 13,000 Wisconsinites to this pandemic. That was one of the things that shared with us. Even though things are getting better, we're going in that direction of some kind of normalcy. Again, we have to keep that safeguard to what's still happening around the world. So we want to keep encouraging people to continue to take care, and we've got to watch what can still come our way. I also wanted to, we're working on different issues within the tribe, and on national calls that I've been participating in, the drug epidemic that's hit the nation and across any country, we need to continue the work that we're seeing with our people when it comes to the epidemic. And I just want to share this real quick with you here. We also talked about the tribes throughout the state, when we meet with the governor's office, and the Menominee res got hit real hard within this past week to 2 weeks. They lost 6 young people.
Is that with COVID-19?
No,
It's the new one.
fentanyl.
Drug overdose.
Fentanyl. And so we need to watch in our community. For those who are battling those addictions, what's coming our way. We lost a couple people. But we don't know if it's the same, if whatever it is. And very tragic for the communities when we get hit like this. And we're trying to battle this. And so we're trying to address it in ways that we can. And we're updating our tribal action plan. We're trying to update all the information that we have, and we're trying to keep building on the services that we have in our programming. And we continue to send our people to treatment and to get the care that they need. But we're looking at a site now because we need transitional housing. And we have our COVID homes emergency shelter, home men's shelter, but we need aftercare and transitional support for those who are coming home from treatment, because they're just going right back in the community and they're not able to be as strong as we would like them to be during those times. So we're going to try to keep building on that. And we had some bumps along the way with our new elder center, but we are still moving forward to having a new building constructed now for our elders and our public safety commission. But one of the key things that stands out to us and across the nation, again, Indian country, is homelessness and what we're seeing with our populations and how we're going to address that. With our tribe, we are looking at different levels. Some of our people need support, they need services, they're homeless for whatever reason. And they cannot get into housing to the tribe or to the county or other ways because of maybe past behavior or things that they have done or whatever. So we're trying to work on ways to help address that at one level. Then we have those who work. We have low income housing, but again, we've got a waiting list, just like the county. We've got this waiting list, we've got those people are homeless, living with family or living there, just trying to get through these times. So we're trying to address that. But then we have those who are working and who are doing well and who can make a commitment to a home now. So we're trying to help them get into their own home. And so we're trying to address things across the board. But and we still have those who have nothing, so we're trying to take care of them the best way that we can. Now, with the other part is we want to educate now the community on what's happening, and so we want to build on education. We now have lifted those where we can have more community events or gatherings or educational pieces. When you have the drug trend presentation, we're going to have another one coming up soon now for the healing. We're going to have another one in the fall. So we keep educating our people, all our people, on what's happening. And in those arenas now that we are able to see the things that we identified, we have to intervene and break those cycles that we're seeing with addiction and those behaviors and reach them and get them help as soon as we can, but prevent it from happening to begin with. We want to keep educating. And so those are the measures that we're taking or trying to build on. And so we're going to be pursuing that. And we're looking at, the tribe looking at having an adolescent treatment center in the middle of all the tribes. So all the tribes are going to be contributing. But we need here detox, residential something here for all our people. So we're trying to look at ways in how we can make those things happen and continue to build on what we have at our college, so we keep educating our community members. So we do have the dorms coming, so we're gonna let that word out. I don't know if I mentioned that last time or not. We have a grant that was submitted to the college campus. We will have dorms for our students, and then try to have some housing for our staff members who need that support so they can stay here with us and teach. But the dorms for our students, so.
How many rooms do you know?
I don't know exactly yet. I don't know the exact number, but it was a $5 million grant. So it's gonna help big time.
We have some, I think, some students at the hospital who drive from Minneapolis,
Yeah,
like twice, 3 times a week to come to do their
Yeah.
interns, their practical.
and speaking of nurses, because of the shortage of nursing now in the health field, how many people left the health field because of the pandemic and we're losing them to stress, everything. We have a program in the tribe that is educating them. They do travel from the cities to come in
It's incredible.
and get their degrees. So we have this for our people. So we want to keep encouraging our people to go on to school. But is there anything else?
No, that was perfect.
Has her hand up.
Dawn,
Yes, sir.
you have a question or comment?
Comment. We can all sit at this table and discuss, we need transitional housing. Monies, I would ask why hasn't any been built yet if the tribe has received the money since last year and I thought a housing project was going to be built. Second of all, we can have transitional housing. We can have all the drug rehab facilities available, mental health available, but unless the problem is solved, which is the drugs coming into our country or into our county, it is not going to make a lick of difference. Because if people do not relocate and start their lives over, it is a continuous vicious cycle. I know from personal experience, family members, I have had somebody die from mental illness, took a life of a 16-year-old child along with his own and tried killing somebody else. So where I stand on these positions, it's not that I'm upset about how the county's doing things. It's, I see we're going nowhere and we keep talking about it. I would ask, we have so many homeless people, not so much housing in the area, but there's nothing in the last 2 years, and the county's getting government money, the tribe's giving government money. I don't know how many it's the housing's being built for the college, the students for the college. I don't know if it's going to house anybody else at this point, and we haven't gotten a number of how many it would be and where it would be built. That hasn't even been discussed. But going back on the drugs in the area, I will say this, I was quite disappointed. There was a post on social media because a child in Radisson was lashing out and punching holes in walls, a 15-year-old young man. Unfortunately, tribal members jumped on board on social media and actually personally attacked one of the members of the HHS division for the county. And I stepped in and said, maybe you should come to an HHS meeting. Maybe you should go to a tribal governing board meeting. If that does not stop happening and everybody come together, it's so-and-so doesn't do this, they just won't even help you. The county doesn't want to help you. HHS personnel doesn't want to help you. It's, why would we even, they're against our kids. They're against these kids. Nothing is changing. I've been here for 2 years and nothing is changing. It's the same old rhetoric. Mindsets are the same, fixed mindsets. No one wants to grow. Everybody wants to blame somebody else, and it's not getting done. So unless the tribe and the surrounding Sawyer County area get together and try to break the cycle and stop the drugs from coming in and getting help for individuals, it's just going to keep happening, and they're just going to keep pawning their problems off on somebody else, and it's always somebody else's issue. That's all I have to say.
Okay, thank you. Any other comments? Joey?
Okay, I'm gonna send some things this way, and then if you want to send some that way. Okay. All right. There's doing 2 different pieces. Yeah. No, there. Just take one. Here. Okay. Yeah. You got there's 3 pieces.
Oh, thank you.
Just one for the.
Oh, yeah. Thank you.
Look how pretty that is.
I know.
Yeah.
Okay. All right, Meals on Wheels. That is probably one of the biggest things. Like everybody else, we all face this lack of employees, nobody applying for jobs. Unfortunately, before the pandemic, the Hayward Senior Center had roughly maybe two routes, maybe 3 at the tops. Now we've got 4. Unfortunately, because we don't have enough Meals on Wheels drivers, hot meals go out Monday, Tuesday, and Wednesday, and a frozen meal goes out also on Wednesday with the hot meal, because we do not have any drivers for Thursday. So then on Friday, they get a hot meal again. Now this week, because it's Easter and we're closed on Good Friday, on this Wednesday, tomorrow, there will be, I wrote it down, it's like 80 some, there will be 84 frozen meals that go out tomorrow, plus the 65 to 70 hot meals that the drivers, the 4 route drivers have to take out. You know, we need a lot of employees in a lot of places. We've got this brand new bus that you can see in the packet. We have just 1 bus driver. We lost our part-time bus driver that worked on Mondays, and we lost our assistant on the bus. So because of that, the bus only runs Monday through Thursday from 7:30 in the morning, because they take people to work. People from Ventures, they pick up, take them to Ventures to their jobs and stuff like that. And then Bob can't work more than 40 hours a week. He's also 80 years old. So on Friday, the bus just runs from 8 o'clock till 1 o'clock. Unfortunately, on Friday, we had someone who didn't quite understand that Bob was done at 1 and had to sit around and wait for her until 2:45. But so if you know of anybody that, you know, has an hour to an hour and a half on a Thursday that would like to deliver meals, we could really use them. Anybody that's interested in being a substitute bus driver on, you know, we can guarantee them every Monday plus Bob's vacation. And looking for, you know, someone that's retired that wants to help, you know, people with their groceries on and off, because something that we do different from Nemacolin Transit is when a person gets on the bus, we have several people that we take grocery shopping that have limited vision. So that bus attendant would go in the grocery store, help that person get their groceries, get them in their cart, help them check out. We also have a couple individuals that we take shopping that are very short, that have a hard time reaching their groceries in the grocery store. So, you know, we'll do that. Right now, unfortunately with Bob, he can get him with some people, he can get them to their house and get them in the house. If you can even get in the house. We've got a couple of people on the bus that you'll get their groceries to their house and there's no way to get into their house because it's just a mass of whatever. So if you know of anybody, I mean, of course we need, you know, cooks at all of our sites. Poor Jen in Exelon has for almost 2 years now by herself, cooking the meals for both Winter and Exelon. We have drivers in Exelon that are also doing the routes in Winter that are putting on about 100 miles a day. So, I mean, it's not just at one site, it's all our sites that we could use support, you know, Meals on Wheels drivers, cooks, you know, volunteers or whatever. But our numbers have really increased with the pandemic, and our numbers are continuing to go up. I would say in an average month, we probably get anywhere from 3 to 7 new people on Meals on Wheels. So there's a lot of people out there, you know, with a lot of needs. The bus arrived on Wednesday. They were supposed not to arrive until Thursday. It arrived on Wednesday. I took some pictures. Bob today again said, "Oh, I can't wait till it gets here. The seats are going to be easier to clean out because the old bus has cloth seats and stuff like that." It will go once everything gets all set up with the new bus. The old bus will go into the graveyard, and then when Nemacolin Transit has an auction or a sale, it'll go up for sale at that time. But until, you know, they have their sale, it'll go in what Karen calls the graveyard at Nemacolin Transit. So she said you might get $500 for it, but you know, it is what it is. But and then in there is our meal count, and then if you kind of notice, if you're watching or tracking the numbers, In March now, the numbers have gone up, and the reason they start going up in March is because our snowbirds are coming back. I had one of the snowbirds come in to see me today. So the numbers at the meal sites, you know, at most of them, like for example, at Hayward, Exland, and Stone Lake, the numbers are going up. And you'll see a drastic jump in Stone Lake numbers, especially for breakfast and lunch, more so for breakfast probably in the next month and a half, because all the snowbirds will be back and all the people that stay at that first campground when you come into Stone Lake, the old Duran farm there, when you first come in, Metcalf spot, all of that. All of those people go there for breakfast every morning at the Stone Lake Senior Center. And I know the people in Hayward are anxious to get that new bus going because once a month they go down there for omelets in Stone Lake. She makes very good omelets made to order. So, you know, January, February are usually quiet months, but in March and April we start to pick up again, and then our numbers level off. So that's kind of where we're at. A lot of exciting things over there with the new bus. That's been our big priority lately, is the bus. And I can, again, as I said before the meeting started, we could thank Karen at Nemacoggin Transit for doing all the legwork, and for Chuck Van Etten and Mark Helwig and Dale Olson for doing that resolution that went to the county board.
Thank you. Any questions for,
I do, Chairman.
go ahead.
Julie, so the winter site is not open, correct?
No, we cannot find a site manager.
Right, I see that all the time. So your meals for winter folks are cooked in Exland, and then they have to be delivered. So the people in winter, it gets home delivered then,
They get
correct?
home delivered and they get carry out.
Yeah,
So they
carry.
can call and do that.
So where do they go then to socialize and?
Well, we've talked to the churches down, one of the churches down there, they can go there. In fact, the Lutheran church, which is just past Patty's on 70, the original pool table that was at the old senior center is there, and there are people that go there and play pool. The depot is offered for individuals to come there and socialize. To our knowledge, they've not, you know, partaken in any of that at this point.
Okay.
There is an individual that keeps saying that they're interested in the site manager's job. We got a phone call last week saying that they didn't get the application. So last week, Shirley Armstrong, our senior resource center board member, was in the office, and we put another application in the mail with a self-addressed stamped envelope, and we have not gotten that application back yet. Or they have not, you know, called us or asked for an interview at this point in time. We just had 2 weeks, the last 2 weeks in the Sawyer County Record. We had an ad because our site manager in Hayward had to step down for health reasons. She was most recently diagnosed with MS. So she went down to 2 or 3 days a week. And then we had another cook in the kitchen who took another position. We did not have one phone call or one person stopped in for an application for either of those jobs that we had posted in Hayward. So it's not just winter, it's excellent. Nobody has applied, you know, for any jobs. We're also at a deficit, I guess you want to say. We can't offer the wages that some of the places downtown can, $17 an hour.
Yeah.
You know, when we say that we can only offer, you know, on the high side, $12.63, they're not interested. And we don't have any benefits.
You know, it seems to me like the food shelves, there's a really pretty vigorous group of people who have those. Is there anybody there who's willing to, do they have you advertise there? I mean, they're retired, they're doing that volunteer.
We have a couple food shelf people that do deliver meals for us.
Okay.
Yeah, and the food shelf every year helps us with our survivor boxes and stuff. So yeah, no, we have a couple people from the food shelf that do deliver meals for us. So
It's a good group of people.
yeah.
Yeah, and they are very ambitious.
Yes, oh
Yeah,
my
they
gosh,
are.
yes.
And I think too, one of the things, and I personally, my friends in the grocery store, emails, Facebook, messages or whatever that are just sitting at home that are newly retired or retired for a while, well, I don't really want to do anything, you know. And I think we were talking about it at work today, and I think one of the things that I'm seeing in this community, and Tweed, maybe you, because you've lived here as long as I have, and your parents lived here, your grandparents lived here the same as me, And I think that our community's become largely a retirement community. A lot of people are retiring here, and when they retire, they don't really want to do a lot. I think that's, one of the things I'm finding in my friends, that are retired. It's like, I told one of my friends, get out of your purple pajamas and get in your car and deliver meals for us, And she's just going, I don't want to do that. I don't like old people. And I go, what are you? She goes, well, don't
Okay.
start you're old.
Okay.
I'm older than you think. But I think that, it's, and it's really hard, it's finding that, not everybody is someone that likes to volunteer and stuff like that. I grew up in a family where that's what we did, is we volunteered all the time. I followed my grandmother to the nursing homes and played bingo.
Okay, any other questions for Senior Resource Center?
Well, I got one more, Chairman, I'm sorry. So then your budget, you probably had this position budgeted, right? Every year, so you just have a surplus in your budget then, or do you?
Well, not necessarily, because the price of food has gone up. I'll give you an example. The marinara sauce that we always use for our spaghetti has gone up. It used to be $39.92. Barb just showed me yesterday when she was doing the order that is now $51.56. So prices are, it's kind of like when Barb was out on medical leave when she had her heart surgery and I did all the ordering and stuff like that. When I first started doing the order, for example, a flat of beef was $89. The last time we thought about ordering a flat of beef, and there's 2 flats in a box, over $300. Yeah, so and there's things like the containers that we put like the salads and stuff in, we can't even get them, so we have to buy different ones that are more expensive. And lots of times, like we have 6 cases of styrofoam cups sitting there that we haven't been able to get lids for 4 months. So yeah, the money is budgeted there. It's not necessarily in surplus. It gets moved to someplace else until those positions are filled. So we're constantly changing our menus and what we buy. And
All right. Anybody online? Okay. Thank you, Joy.
you're welcome.
Admin, adult long-term care.
Lori's got a report here for your review. I'll highlight a couple of things. She said the APS referrals remain steady and we still don't have any interest in the part-time APS position. Nobody's applying for it. She did note there's some initiative about enhancing the APS interdisciplinary teams by having law enforcement more engaged, and Sawyer County I-Team, APS I-Team indicated to the state they're interested in being part of that initiative. With the ADRC, that new phone system she's got noted in here, it's going to be installed on April 5th, and it's more efficient and considerably less expensive than the old one that was in there. Talk about an increase in walk-in traffic coming through now, and remodeling goes at a slow but steady pace over at Oasis, and that's pretty much the old Oasis building. That's her report.
Anything on behavioral health?
Alicia's been out on the mend, so we don't have one here, but I did talk to her and she said it's pretty much status quo as the other reports you've seen recently. And the mental health cost by client that Cindy Hannes puts together, she's going to revise that and have a different sort of report for you next month.
Okay. Child protective.
Joe raises his hand.
I'm sorry. No. You have something to say?
Yeah, I just wanted to make you aware that we continue to have an increase in mental health contacts for people from nursing homes. With people that are in there with dementias that are becoming increasingly violent, they keep calling, trying to put it through the mental health system. There's no safeguard in there for people that are in nursing homes with late stage dementia that become violent. And there's no really protective measures throughout the state, and it's becoming real problematic. So they try to treat them and say it's a mental illness that they have, but it's a progressive disorder. And it's not really a mental illness. They're not treatable under Chapter 51. It's not a treatable illness. It's a progressive illness. So we're seeing more and more of that. Nursing homes are calling police officers to come there to dispose, or these assisted living, to dispose of situations that they're not trained to handle. I don't know what's gonna happen with it, but it's on the increase, is all I'm saying.
Are these people who could actually end up in,
Mendota or Winnebago, like?
Yeah.
No, because those programs are for mentally ill people statutorily, not for people with infirmities of aging, degenerative brain disorders, you know? So it's really problematic, where do they go? And the state hasn't really worked on developing any crisis placements for people that have those problems, you know? So it's very hard managing, just, you know.
thank you. Child Protective Services.
Can I add one thing the adult long-term care might put, I forgot to mention that Lori was going to retire this summer, but she's staying on to help that transition over to the Oasis building. So
Yeah, I just saw that.
I don't know.
thank you for pointing that out.
Chairman, did we cruise right by mental health costs by client report?
No, actually, I commented on it. I said Cindy
Oh.
Annis is going to create a new
Yeah.
report for you next month.
Oh, okay,
Revised
I'm
report.
sorry. I'm
That's-
always interested in that, so thank you.
Really? You thought I made a mistake?
No.
But if you want to look at numbers, it's always on the purchase services handout as well, but I just try to have another one out there so you can really
Thank you.
look at it. So we're gonna have another one next month.
CPS.
Okay, you have the usual CPS report and the placement costs. I also want to note that we're still recruiting for a social services aide. We haven't found one. However, in youth justice, we have recruited a youth justice social worker with not one, but two, but 3 years of experience.
Wow.
So her name is Sarah, here we go, Lynn, Inzauskis. She should be starting in the next week or two. And you have your economic support from, let's see, she had on even, pretty much the usual stuff, hitting all the marks, timeliness and stuff. And then we have public health.
Okay, well, COVID continues to be low, so that is
Yes.
really excellent. And we saw just a tiny little blip about a week ago, not enough to even move us out of low, but we're watching very closely to see what happens there, but not seeing anything there. The one update I can give you is that we are definitely getting into the BA2, which is the second Omicron type of variant, but it does not seem to be really raising our numbers anywhere across the United States. And it's about 60% of everything that has been sequenced. So it's definitely there, but not really causing a blip like we saw in Europe. So we are going to hopefully continue down that pattern. The other update that happened was the vaccine boosters for those 50 and older. A second booster is now recommended and can be obtained as long as it's been 4 months since your previous booster. So that's the other new thing that had come out. We're busy working on our community health improvement plan. Sherry and I were on the radio last Friday and on April Fool's Days of all day, but gave a report on that, and we'll be working on putting together a website, an email, phone number, so that we really can get the community involved in this plan. And then a lot of the work that we're doing right now too is, well, actually one of the other things that's in here is we did get a grant to help us work on the community resources guide, and it's not really a guide, but we're looking more at a database. So we're kind of pounding the pavement, trying to get everything set, trying to figure out how to gather the data and put it out there in a way that's most useful. So we've been working with a volunteer group that's been kind of guiding us on how we best do that to get the information and to keep a database that can be updated and stay updated very easily. So team is working really good on that. And then the opioid settlement, we're really trying to get a handle on where we're at. As Lorraine was stating, lots of overdoses happening all over the United States, Wisconsin, and here at home. So we need to really start to figure out where our gaps are. So our first meetings occurred where we pulled all law enforcement together. And we had representation from every one of our law enforcement agencies in town or in the county. So that was really a very good session. Definitely homeless, Lorraine, we were talking about that. That is one of the biggest concerns is that transition. So we'll be kind of honing in on that area. Looking at children and the impacts on children, one of the big things we know is that children that experience traumatic experiences when they're young, they're more likely to have substance misuse disorders as they get older. So how do we work on that prevention side? So really thinking about that as we move forward. We also met with Justice Point as well with that. And then we will continue to work through working with the schools, working with CPS and all the different agencies to really identify where they find their gaps and bring people together. So we want to be ready when those opioid settlement grants come out, that we have a plan on where we want to go so we can apply for the right funding at the right time.
Is this separate money from the
Yeah,
opioid settlement?
the state gets funding as well. So the state has to give 70% of that back out. And they plan to do that through different types of grants. And so right now what they did was they had surveys and a lot of community listening sessions to figure out where should that money be spent and how should that come forward. They just don't know when they're going to get their funding. Everything is kind of up in the air as to what's going to come in and when. So we just want to be prepared and ready to go and match that up with what we can spend our money on as well.
You said we, who is we?
We as in public health
Public
is
health?
working
Okay.
on this, yes. Along with, we'll be pulling in everybody else, but public health is really kind of trying to do that gap analysis right now.
Have you reached out to our behavioral health staff?
Yeah, well, we're started
working
with
on
law
it.
enforcement.
All right, okay.
We started with law enforcement because we work so closely with the jail and just trying to figure out, we know there's other gaps there that we're trying to address and if we can address those kind of all at the same time. So yes, everybody in HHS will be interviewed by the team as we work through. Yes.
Mike, is this money separate from the counties?
I think it's the
Opioid?
same, I think it's the same money.
Same money?
It's the opioid settlement.
They'll have the settlement, but they are giving most of their money back.
Oh, I understand that,
Yes.
but
Oh, I see.
there's
The
other,
counties
there's
get a
other,
good sized chunk.
there's other people looking at that same pot of money,
Criminal
The state's pot of money?
or the county's pot of money.
Oh,
We'll have to talk offline. on
Yeah.
that.
Well, is there conversations between the county and the tribe of how to be most efficient, how we're using that money, or is it gonna be, I mean, I just add that Joe has brought up several times in here about having conversations, comprehensive conversations with one another about what to do with, how are we gonna handle the opioid settlement and all the issues related to that we're trying to address. And maybe it's kind of like Dawn was talking, we talk about this stuff a lot, but I don't, it leads us to where we're at right now.
Right.
Right, and
what we're doing is a gap analysis to really
Okay.
identify
Yeah.
where the needs are. Because there will be state funding to apply for.
Okay.
But we have
but it'd be wise to do that.
the county money as well and tribal money that we should be.
Will you be taking some into the schools for education and like, remember they used to have the DARE program or things, I don't know if public health's involved with that, but
We'll be working, so as we interview each of the areas, our plan is to then really create a group that will be like addressing, like, okay, where are the gaps?
Yeah.
What does evidence show is the best thing to put in these places? And that'll have to be a whole coalition that does that. Right now, we're trying to just do the gap analysis because when you pull a group of people together, you can sit and talk about it and talk about it and talk about it. But until you start diving and finding out where the problems are and where the gaps are, it's hard to know what to do with that group of people. That group of people can make decisions, but they have to have information. Yep, and then.
So your suggestion is, go ahead.
Go ahead.
You're suggesting that this is like a starting point then,
This is just a
right?
fact gathering.
And then you get, all right.
That's what I
Gotcha.
would suggest. We've had a coalition that met and really didn't get a whole lot done because there wasn't, nobody took the time to back step to really look at what's there and what's not. And plus COVID's happened, so what
Right,
was
right.
there is not necessarily there anymore either. Or maybe more things are.
We,
And you have started discussions with the tribe?
We pull, we
He's right, we're
just,
gonna get some money. I don't think
Yeah.
we're gonna get what the county got, but
and I don't
we've
know
got some money coming.
I don't
We
know
would like to collaborate.
who
and
has, like,
Put our
who's-
efforts together and really go after this.
who's the lead on who's to pull in. Right now, what we've really done is we pull, as far as law enforcement, we had the tribe involved, like, it's all law enforcement, that's where we started.
Well, we have a drug task force, right, Lauren?
Well, Marie Beasley's program, they've been meeting and now they're starting to make more connections too, so it ties together.
And,
That's right.
and Jess Bjork sits on one of those, so she might be on that one. So we're trying to kind of connect the dots, but yeah, we don't have all the dots connected
No.
at all.
May I speak, Chairman?
I'm letting the committee members speak first. Go ahead, Deanna.
I am a committee member.
Go ahead.
I'm sorry, you're right. I apologize. Dawn, please.
This goes back to, we started getting money, beginning of 2021. Tribal county. We knew that the issue was prevalent in our community before this even happened, regardless of COVID or not. And Julia, I'm not attacking you. This has nothing, I know you've been put into this position. Again, we're behind the 8 ball. We should have been doing this. We know what the needs are of the community. We're now pulling the police in. The police are going to go at the drug task force, everybody that's within the drugs that we need to pull it off. That's their separate entity from what HHS. That they need to handle their business and get the drugs off the street. HHS and the tribe and the county should all be working together to make sure that they aren't what is the kids and everybody are using to get through for alcoholism or other addictions, or mommy and daddy left me, or I don't have a mom, I don't have a dad. We are so far behind the 8 ball on this stuff, it's not even funny. This should have been, we knew the money was coming. Again, Tom knew how much the tribe was getting, what the county was getting. None of it was put in place. We should have been on this from the beginning and trying to get something. We have all those people that are in the hotels in Hayward by Marketplace with all the issues. You look, all you have to do is look at social media and see them running around with no clothes on, or they're passed out McDonald's, they're ODing and they're Narcanning them 4 times. This is how many more people have to die? How many more people have to kill themselves? How many people if they're getting pure fentanyl? That's what is in our community. My dad is a retired law enforcement, 35 years Chicago. This is so far behind me, and I'm so just upset and disgusted with how things are going. It's $10 million for a courthouse, but we're just now talking about people need housing, or we need to do something because of the addictions. This has been ongoing since before COVID even started. I'm done.
Okay, thank you. Deanna?
Carol.
Carol.
It's okay.
Yeah.
I agree with a lot that Don said, and it is a tragedy. We've known about this for quite a while. What is the timeline, and do we have to have plans submitted before any of the money is released? How is that working, and where are we at with closure to apply for the money so we can start using it? I don't know what the timeline is or how this is working. I guess I'd like to have that explained. Do we have to have a plan in place and submit it from the tribe and the county unified plan? And if we're late with our plans, do we get what's left over? I don't know. I'd like some of those questions answered.
I can touch a little bit on that. We are participating in a webinar with the people who disperse the funds for
Okay.
the opioid settlement at the end of the month. We're supposed to find out what the timeline is for receiving the funds. Maybe we're gonna find out what our allocation is gonna be. We don't know what our allocation is at this point. So again, the end of April is that meeting. I think it's like the 27th or something like that. We'll get some more information. I know there's documentation out on what is eligible for the funding of that program. I have not really read it myself. I don't know that you need to document or send in a plan of how you're
I
spending.
think you do.
For the county, you're gonna have to say what you're spending it on, because it'll have to be within that settlement area.
And that makes sense because a lot of this, like this ARPA money that we're getting,
Mhm.
there's annual reporting we have to do on that. So I'm sure it's
Yeah,
similar
it'll be
to
similar
something
to
like that.
Right.
So the other portion that I'm talking about is the state's portion that they're going to redistribute out,
Mhm.
because they're not planning on keeping hardly any of what they're getting.
Okay.
And so there'll be different types of programs that they'll put that money into. So it could be prevention, it could be counseling, it could be housing, there'll be different pots of money. We need to know where we want to focus our energies on
Exactly.
so that we can apply for those when they come. I'm not anticipating that coming within the next few months. We have time to be able to
Okay.
actually gather information, really pull together with the tribe and determine, where do we want to focus? And then there is funding that already does come annually at different times and in bigger pots of money, but you can't really apply for those unless you're all working together towards a big focus. So usually when those come, it's a little overwhelming to see that, to determine how we would use it. So we just don't want to let opportunities go that we could potentially write grants for.
Exactly. So I guess I'm asking Julia, what kind of help do you need and what people do you need at the table to discuss the plans and fine tune it so that when the money is released, we know where it's going, the priorities in our county and in our tribal communities. We need to pinpoint it. So what kind of help do you need?
Right now I have, we're able to use the Just Recovery Grant dollars to be able to have our staffing to be able to start doing the interviews and documenting them. So we're trying to meet every 1 to 2 weeks with somebody new. We just started these interviews. So we'll be going through this week we meet with CPS. Last week we met with law enforcement. Then we'll meet because we want to meet with each individual HHS agency that's supporting and seeing where their gaps are. Along with, we'll need to be working with North Lakes and also LCO with the treatment center. I've already met with them, but we'll want to meet again to kind of see where things were, because that was about 6+ months ago since I met with them. So, and we need to meet with the hospital. Where's the gaps? They see overdoses every month, or every week, I should say, not every month.
So if you send a memo out to these agencies and these people that you want to gather this information, wouldn't that put you a step forward so that they're prepared when they get to the table with you? No?
Yeah, they're talking.
Okay.
We'll keep plugging away, but as we find, if we interview one person, we interviewed law enforcement, that really led us to, we need to go to CPS next because they need to work hand in hand. And then it'll be most likely Joe and Alicia will be next because of everything that they're working with. So, and we need to get to the hospital. So there's lots of different places that we need to get to. Yes.
Okay,
Thank you.
whatever money we get, I think it's fair enough to say it's not going to be enough.
Right.
Oh,
Here's
no.
here's what I don't know, and you're looking at gaps. Is I don't know where's the most efficient place to invest the money to get the most bang out of your buck. I don't know that. Is it prevention? Is it treatment? Is it I have no idea. And I don't know who knows that, But I think we need to find somebody that knows that, because then you can make a lot more informed decision. Because even if you have those gaps, that may not be the best place to invest the money.
Well,
And I don't know who knows that. I don't.
So we're going, the other thing that we'll be going to in May is the opioid summit, opioid and substance misuse summit from the state, which has a lot of different pilot programs and things that have the state's been kind of working on in different areas so that we can learn what's worked and what hasn't worked. So that's the other piece that we're doing as well.
Julie, can I just clarify? So the grants you're talking about the 30%
Yeah,
that the state gets, they're gonna redistribute that, and you're talking those funds.
mhm.
Okay, that's separate from the
Plus-
70%.
That
I was
distributed.
referencing the 70%.
Yes, yeah, so there'll be two different, so, but with that too, we have there's stipulations on how we should spend that money, and we need to figure out the best way that can go.
Yeah.
Because we don't wanna just throw money at, just because somebody said this would be a good thing to do.
So you need factual evidence in order to submit some plans.
Yeah, and for us, we would need to know where we really wanna focus in on our programming in order to apply for the right grants, yes. And we need partners. That's usually bodes really well to getting grants, is that you have partners that are written into the grants.
Right. Thank you.
So it'll be a big focus for public health moving forward. Anyways, that's my report.
Thank you.
I thought it was gonna be short.
Did you want to share the plaque you got from
Oh,
Elmer?
no, I forgot, thank you. Yes, we also received a commendation from the governor as well. So I can pass that around. It kind of has the same kind of language as what Lorraine already read off from the tribes.
Did you get a pretty one like that?
It probably did come like this.
We did.
I didn't see, did you see it? I didn't see it.
And again, that's for work during COVID.
That looks like the same word. Pretty much. Yeah.
Okay, fiscal, we have the budget performance report, services recap. Everybody's got those. Any questions, concerns? Future agenda items. Matters for, I'm sorry, correspondence, reports. Anything for discussion on that? Okay.
I guess, I think,
Yeah.
Dawn and who else is leaving? Oh, yeah,
Gone down, Chuck.
we're all leaving. Yeah, we're losing 3 off the Health and Human Services Board, so I guess I'd just like to say, we're gonna miss them, and I appreciate Dawn and Mr. Olson and Mr. Bennett, your participation in Health and Human Services and the county board, so we really appreciate you. Thank you.
Thank you.
For discussion only. To replace citizen member on this. As indicated, she is interested in being that person. There's been some thought about advertising in the newspapers, finding out who else might be interested.
We did that.
Pardon?
We did that for 2 weeks.
Well, that's been done.
That's been done.
Oh.
I didn't know, was it my name that was put forth for it or no?
Yes, your name has been given to the committee chair.
Mhm.
I'm not sure where we go at this point.
Would that be done at the April meeting?
I have
or
no
the-
idea
the-
what was on the agenda last time. Everybody looked at me like, why was on the agenda? So,
Because they're
so now
out.
you're looking
Yeah,
at me,
they're
so,
out.
because it wasn't for me to decide, so.
Some of our folks are out of sync with the
Okay.
terms,
Okay.
and
we thought maybe then do them all at the same time as the other board
In
members get
April, when we
appointment.
appoint committee members.
Yeah,
Does this board appoint the community members though?
Yes.
yes.
Okay,
And,
Then I'm glad
and the
we have
one
this.
that's leaving, there's a criteria of, please explain the criteria, Paul, for that position.
The person either has to have received disability services from the county or one of their family members.
I meet that.
Well, we'll put it on next month's agenda then. Okay, anything else? We're done.
all right, thank you.
By the way, do you go out?